I'm Brian Winnikin. So we are at Washington Watch with the National Association of Farm Broadcasting in Washington, D.C. And our broadcast being brought to you in part by Growth Energy, also AMPI, the Ann Thompson Insurance Agency, your American Family Insurance agent in Mondovi, the Animal Wellness Center of Buffalo Valley, and Annabis Silo. Joining me right now is Chris Galen with the National Milk Producers Federation, and we are going to talk about raw milk. And it's a big topic in Wisconsin, that's for sure. And Chris, thanks for joining us. Wisconsin a couple of times has tried to pass a raw milk bill to allow the sale of raw milk, and it hasn't passed both times. But as from National Milk's perspective, are you seeing more states wanting to do this or less?
We're seeing a lot of states wanting to do it. I think what's happened, Brian, is that fewer states are actually able to pass these laws, because what's happened is that the dairy industry nationally is working now more closely with public health officials in these states, as well as at the national level, to remind people that pasteurization is one of the greatest public health advancements of the last 100 years. Why are we trying to roll that back? By increasing the availability of a product that's demonstrated to be dangerous to at least some people. Why would you want to do that and threaten the health of your citizens? Now, that's a point we made with Governor Walker in Wisconsin, as well as in other states, and I think the legislators and people like the governor of Wisconsin are hearing that more clearly now from the dairy industry, as well as from doctors and medical people.
Again, talking with Chris Galen from National Milk. Now, Chris, some folks will say this is more of a choice issue. I have a choice to go to a dairy farm or a beef farm, buy a cow or a steer, have it processed, and eat raw meat. And that's a delicacy in eastern Wisconsin. A lot of people do that. We don't have rules against that.
And we also don't have rules against you buying alcohol and tobacco, Brian, but you got to be at least 18 in the case of one and 21 in the case of the other. And I think that's where the choice argument falls down, is because we know that a lot of the raw milk that's being procured by adults, consenting adults, is actually then turned around and given to their kids or maybe their grandkids. And those kids don't necessarily have the same amount of informed choice. They're not old enough to reach the age of consent to make decisions about a potentially hazardous product. Plus, also, we know their immune systems are going to be more vulnerable potentially to the pathogens that could be in that raw milk. So I think that's the issue that we've tried to remind the lawmakers, is that we've seen time and again people get sick from raw milk, and it's often the kids, minors, who suffer the most from this. So that's where the lawmakers have to stand up and say, this is about protecting the health of our most vulnerable citizens.
Again, talking with Chris Galen with the National Milk Producers Federation. You said you see a lot of states at least exploring this, but then deciding, we're not going to do this at all. Is that something that's really just, do you expect to continue?
Well, we know that there is a very vocal minority of people who want more access to raw milk. And in fact, there's been a bill introduced here in Washington just in the last month that would increase the ability of raw milk sales to travel across state lines, the interstate sales of raw milk, which currently is illegal, but this bill, which we oppose, would increase the availability, the opportunity for raw milk to travel across state lines. So you're going to see those pressures out there. What we have to do is remind people of why pasteurization exists in the first place. It's to increase the availability of a very healthy, natural product, take away the potentially bad germs that could be in there, and still give people the health that they need. Raw milk may be healthy for some people, but it also may be very dangerous for others. You can't really tell or test your way out of that conundrum, and that's why we have pasteurization, and that needs to be kept in place, that system.
Well, again, one of those issues that I'm sure is going to be coming back up in the state legislature in Wisconsin again, and maybe even nationally. Again, Chris, thanks for joining us.
You're welcome, Brian.
Chris Galen with National Milk from Washington, D.C. I'm Brian Winnikins.